Keeping people safe at home is the heart of our work. We've followed the development of the care transitions work from its infancy and enjoyed the partnership with the Eric Coleman model, Robin Golden's Bridge model, and our own home meds program for social workers and others to gather medications in the home.
I think the game has changed for most hospitals in that length of stay used to be, if you will, the holy grail for most hospitals, and the holy grail has now changed. It's readmissions.
Diabetes was never among our top 10 admitting, let alone readmitting diagnoses. And then our diabetes appeared as our top. That was tied to one particular patient, crisis after crisis after crisis.
So in the middle of 2014, we were able to facilitate funding for Mistel to have continuous glucose monitoring sensors.
I have not stayed the night at the hospital since September, so it's been almost a full year, which is awesome.
People say, well, it's only one. Why bother? Because one can become two, become four.
We had project managers who were sort of hand-holding the whole project pretty closely. So they started them out with sort of the charter of what we were going to do, and then they were actually in the facilities, both the hospitals and the nursing homes, coaching them along the way.
So a lot of times those patients out in the community, there's various different assessments that they need, and the care transition coach was able to find that she needed some support services, transportation to and from her primary care appointments to reduce the utilization of her hospital returns.
The patient navigation program, especially when we focus on transitions of care, is one of the programs that we do that I take most pride in. When beneficiaries are going from one care setting to another, it's often because they have an acute medical illness and they're recovering. So it's a pretty vulnerable time, and there's a lot that can get missed. We can come alongside them and help them so that they can be an active participant in getting better.